So I'm now joined by John Farrell from LANUA International Healthcare. John, thanks very much indeed for joining us and joining in part of this debate about social care and the dynamics in it and the demands that a growing older population are placing on the system overall and the society overall. So first of all, though, I'd like you just to tell me a little bit about yourself, your background, and how you come to be involved in the role that you're now playing.
Okay, good afternoon, Fearghal, and thanks very much, for inviting me to join this broader discussion on social care and the challenges facing it and how we can work together to try to address those challenges. I'm a sort of a mixed career person in a sense, in that I was what one would describe as the career civil servant, and I spent a large proportion of my time with the Northern Ireland Civil Service, and spent 12 years with the Department of Health, where I had a range of policy responsibilities, everything from primary care on one side, right through to e-health innovation, and towards the end on the European Innovation Partnership on Active and Healthy Aging, where I established the Northern Ireland reference site and also established a pan-European network of reference site regions and municipalities, which were working together to achieve the objectives of the European Commission's initiative on the European Innovation Partnership on Active and Healthy Aging. A number of years ago, I decided to take a change of career direction, and I established LANUA International Healthcare Consultancy. And its specific remit is very much about facilitating health and care providers, industry, in improving outcomes for citizens and service users, increasing the effectiveness and the efficiency of health and care systems, and through that, in actually helping to promote economic growth and jobs by allowing all the latest technologies and solutions that are there to support healthcare to be able to identify and find a market for those and moving forward. So, as I say, I have a bit of a mixed career coming from public sector into the private sector, and it's an interesting perspective I have from actually being able to see and to understand the healthcare system, not just in Northern Ireland, but I've also been exposed to health and care systems across Europe. And to see and to understand that, but also then to see it from the other side, where there are things happening within industry through researchers that can make substantial changes and differences to patients and to the organizations that deliver those services. And it's to be able to marry both those experiences so that at the end of the day, we can improve outcomes for patients, service users, whether they're in Northern Ireland, Ireland, or anywhere in the UK or across Europe.
Obviously, a lot of what you were doing and are doing now is hinged upon the growing older population. And your testimony so far is, if you like, straddling both sides. And the decision-making processes in the health service, and then the people that are providing stuff and attempting to get that commissioned. But it seems, I suppose, evidentially, it's clear that one side moves slowly, and the whole system seems to move slowly. What do you think is the reason for that?
There are a number of reasons that I can actually see for that, and I think we are all being exposed. And if I take my broader knowledge was within Europe and what is actually happening within Europe, where that demographic change, where we are having an older population is there. And all the health and care systems are actually trying to address that and improve the outcomes for the older people and enabling and supporting them to live independently. But my observation in terms of what I would sort of classify as the potential barriers to that for the organizations is that there could be resistance to change in a lot of the organizations. We've always done it this way. It has always worked. Why do we need to do something different? So familiarity, people are very comfortable when they're familiar with delivering services in a certain way, to expose them to something different, you can meet resistance. And to address that, the culture of the organization needs to be right. It's not really about an organization saying, we are an innovative organization, we promote innovation. If you don't actually help the staff to actually make that transition, you actually are losing a big opportunity. And some of that can address some of the barriers of that resistance to change. Communicate with staff, take the ideas from them. How do they think the service could actually be improved? Be aware of what solutions and innovations are out there that industry is maybe creating already, that researchers are actively looking at. Ensure, and when you do that, allow the staff to be aware, to be exposed to those new concepts, those new solutions, those new ideas. Also look at the training and development in an organization. We sort of have the capacity for doing things digitally. It would be surprising in this day and age, when we're all used to using smartphones, when we've all had computers for so long, that staff may not be comfortable using a digital technology that's coming through to support an innovation. So what are we actually doing, and what have we done in the past to support staff to actually embrace change? If training and development was not part of it before, you will always have resistance to change. So you need to actually look at where are your training and development programs going? How can we actually enable staff to use the digital technology a lot more? Importantly as well, where the technology may be something that a service user or a patient may be required to use, for example, it's remote monitoring. So therefore, we want the person to do something from their own home, away from a care setting. Has the patient been actually trained on how to use the new equipment, the new technology? And if they haven't, those health professionals that are liaising with those service users and patients, if they feel the patients will not be supported, they too will then be resistant to the change. So I think addressing that resistance to change is a big area. The other big barrier going forward is funding. And when we actually look at funding, organizations are paying a lot of money to deliver services, and a lot of their budgets are directed that way. But the challenge for the organization is that whenever it sets out its budget for the next year or the next 2 to 3 years, it is all about delivering the services that they're providing. So I think organizations need to be looking more creatively in terms of the allocation of their funding and resources. Can they actually identify funding that can be used for innovation and research? Can they support the pilots, the testing, the trials of new solutions out of that innovation budget, so that they can actually provide an evidence base that something different will work for them? And that evidence base is not just about the clinical or the social care outcomes to the patient or the service user, but it's also looking at the efficiency and the effectiveness of the organization itself. And if they provide that evidence base, then they should have a clear plan that actually moves the new innovative solution into mainstream, because they will have identified what savings and what improved outcomes that there will be. And there may be a bit of pain in the short term, but they should not be afraid of the pain to get to the long term, which will lead to better outcomes and more efficient organization as well.
And who should take the lead in that? I mean, when you're talking about organizations, I assume you're talking across the piece. So the people that maybe provide care, right through to the bigger organizations that fund it. But are you seeing leaders in that space that could lead in that development and give confidence to other tiers of organization to follow through, so that not everybody's repeating the process and actually slowing it up as a result?
That is the big challenge. And when we look across public sector providers, public sector organizations, and private sector and insurance, private health insurance organizations, you can see a slight difference. Where government organisations would be is that they very much are funded, and maybe there is a question mark here in terms of how departments are funded. And it's usually on a 1-year budget. Although some countries are actually now moving towards 5-year and 10 years. So they're actually saying, let's look out 10 years, the type of society we want to create. And therefore, we will set our targets, our objectives, our goals to get to that point 5-10 years hence. And everything we do now moves towards that. So you look at some of the regions across Europe where they've actually started to drive towards that. And then you look at some of the other regions, which is more traditional. We will make our bid for our money this year. Well, if we make a bid for our money this year, it's all about the number of people we have to provide the service for. And it's a lot more difficult to actually say, well, let's look at innovation, let's look at actually supporting change and allow it to grow, because let's look at where we try to go in the future. So I think there's maybe a learning in there for when it comes to the governments. Just to say, take a long-term look at where you want your health and care to be.
Just in your experience, John, and I'm sorry to cut across you, but just in your experience then, is that happening elsewhere to good effect? You know, is there something in your European experience that could transfer into our experience on these islands?
Yeah, there is, and that's one of the things is that, and it's one of the things I very quickly became exposed to through the European Innovation Partnership and Active and Healthy Aging. How many regions and countries are facing the same problems, and how many of them have actually started to develop solutions that we all can benefit from. And that's where pan-European networks or pan-global networks allow us to learn where is best practice and what can we actually do to do differently. So yes, there are some regions out there that have actually taken that 5-10 year view of where they want to go, and everything is incrementally based towards that. So they're actually taking that long-term view on outcomes for their citizens. And yes, definitely we need to look into that space. When we actually look then towards the private sector, the motivations can be slightly different, but I would argue the motivations are the same whether you're in the public or the private sector. In the private sector, it very much is about the return on investment. It's about actually decreasing your costs. And therefore, you're going to move to that model very, very quickly. So you will ensure that you have the business model that actually drives out the changes for you, that supports the investment in new ideas and allows a lower cost service, but giving a higher level or at least the same level of outcomes for patients to be actually delivered. I would argue that, you know, the philosophy in the public sector should be no different. You're not there with a bottom line that you have to get a return on investment. But at the end of the day, it is taxpayers' money that come in to fund government. And therefore, your return on investment is how well you use that money. And if you want to actually be effective and efficient in using that money, you need to drive out the changes. Otherwise, you know, you're actually denying that there is a return that you have to make on the investment. Government money into health is an investment. It's an investment in the patients, in the populations. But also, there's another concept of the investment in health, which I was exposed to a number of years ago. And that is actually saying that health is also an investment in economic growth. Because if we can actually have a healthier population, we're actually going to have a population that is more ready, willing, able to work, and therefore they can generate returns to the economy through jobs and economic growth. But also health is an economic investment to the country as well, in that health can actually start to advise, inform, work with industry to identify out the new solutions and new technologies that can actually lead to the economic growth, but at the same time delivers the improved health outcomes. And in that respect, you know, governments really do need to actually start thinking about giving the space for the development and the testing and the co-creation and the piloting of new technologies. But at the same time, It's not just about doing all this testing. There is a lot of testing going on. There are a lot of, in the universities, there are all these new solutions coming up, testing, testing, testing. The difficulty is actually taking something from that testbed environment and actually operating it at scale in a country. It's fine for the 10, the 50, the 500 patients that have actually been exposed during the test to the new solution. But if it doesn't move from those 500 to the wider population, there is no gain at all. And what we end up having is that within a health system, you could have different ways of delivering a service going on, and nobody actually saying there is the best way. And we know it's evidence-based that that is the case.
So in your
for industry, sorry, for industry as well, they're not being afforded the opportunity to develop, to grow the market for the product, the solution that they actually have, and to create economic growth for the country.
It strikes me that there's a, not just a scale in ultimately arriving at scale, but I think what you're saying is there should be a scale in the decision-making process for all to begin with.
Yes.
Not fair.
Yes, definitely. Definitely. Where is our vision? And how are we actually going to go about achieving that vision? And it all comes back to this culture, and is it a culture and a mindset that we will do everything effectively for everybody that we serve now, but we don't look to the future, and we spend all our money over on one side, but we don't know where we're actually going long term.
So as I look at it, and there's lots of evidence out there, I don't mean I, but generally people looking at it, the evidence is there of the growing population, there's evidence of the failures in the system, there's evidence of good practice as well.
Mm-hmm.
But you're right, it seems to be that it needs to move in another direction. So mm-hmm. I suppose I'm repeating the question, who is going to make the decisions to stop things becoming simply activity disguised as movement?
That's where we have to look to the political leaders. It's where we have to actually look to the leaders in government, serving government as well, to make those decisions. Industry will move. Industry is moving. Industry has got a lot of solutions out there. The difficulty that industry has at the minute is actually getting those solutions in. Now that can come from one or two ways. One is that industry don't fully understand the need of health and care, and they have actually started to develop solutions based on their understanding of need. So when they present that, unfortunately, it's not what is actually required, and therefore it can't come off the production line. But equally, industry has a lot of solutions where they have clearly understood the need, and they run immediately into other barriers. And I don't think it matters whether it's public sector or private sector. One of the big barriers that they will sort of immediately come up against when they have something is procurement. And it's trying to get through that hurdle. And that is down to the way procurement is actually done. A specification is written, and the organization will go to the market to look to have the specification delivered. Well, as I always look at it, if we always believed we needed a 10-cogged wheel to actually make the machine work, we'll always go out and specify a 10-cog wheel. But if somebody was to develop a 5-cog wheel that made the machine work just as productively and just as well, the specification didn't say a 5-cog wheel, so therefore the buyers will only buy the 10-cog wheel. So we need to educate those people that are actually responsible for procurement of what is available in the marketplace. We need to also improve the awareness and understanding of those people that will be using the equipment, that the 5-cog wheel is just as good as the 10-cog wheel, and that it will deliver what they actually require. So we need those people that are informing the buyers as well as the buyers themselves to be more aware of how the market can meet the needs. And we also need that other side of the communication, is that the provider of the service needs to be communicating with industry to actually say, this is where we're going, these are where the challenges are and where they rest. And I can think of one example, which I came across a number of years ago. It was an issue that was being faced by a number of regions and countries across Europe. And it was all into healthcare records, and it was into ensuring that the records could not be compromised. So with all the firewalls, all the safeguards, all the standards were sitting around it. But yet in all, whenever we sort of look at the developments, particularly technology developments on health and care, we see a rise in a number of software solutions. We see a rise in the number of apps that can actually be used. But unless those software solutions and apps are integrated into an electronic health record, then the clinician or the health professional does not have a full picture of you or me and our health. So therefore, as a simple example, if my GP said to me, well, John, we need you to do something for your own health and well-being here. We've identified that you have got high blood pressure, your heart's going whatever. You should actually do physical activity. Come back in another 3 months, and I'll put you on the scales, and I'll check your weight, and I'll check your blood pressure, and whatever else at that stage. So for those 3 months, the GP has left me to my own devices, and I come back, and he'll measure it at that point in time. Meanwhile, we are aware that there are a lot of apps out there that actually help us to monitor our own health and well-being. So therefore, there is information being collected on those apps, but that information is not being shared with my GP. So therefore, my GP does not realize that over the course of 3 months, I may have stepped up from walking 1 mile a day to 10 miles a day. I was doing certain activities and physical activities as well as part of it. All he sees at the end is what a result is being monitored. And part of the difficulty for that is that we cannot get the information onto the health and care record system. One region in Europe actually decided that they were going to be brave enough to address that problem. And whilst everybody talked about it's all too difficult, they said, well, let's run a pilot. Let's invite some technology companies with their software solutions to come in and to run their software on our electronic health record. We'll put in whatever safeguards we actually need in order to see it, but we want to see what other information's out there. And the region did this, it's actually started to work, and it has actually started to show how you can actually start to bring information from third-party devices onto your electronic health record, thereby providing better information on the patient and the patient's journey through their own health and well-being. And I think we need to look more to that, but that takes a decision at the top of a government department or of a healthcare provider, or even a political lead to actually say, we will create the environment and the safeguards to allow this to happen.
Now, it seems you know, that's an example, and you've sketched out the extent to which the demands are in the system. But we've known about this for a long time. We've foreseen it before we knew about it and witnessed it as it happens. And yet we're still seem to be in the foothills of the debate. Does that concern you?
It concerns me when I see what is available that can actually improve health and care at the minute. And it concerns me that the population is not being exposed to everything that could be there that can actually improve their health and well-being and enable them to live independently. But I would sort of add that it's not an issue that rests just with health. Whenever we sort of look at ourselves as individuals, and if we take the aging population, yes, health is important for them, but also is their mobility. It's their ability to move around towns, or move around cities. It's transport that's important to them. It's the home that they actually live in as well. And we actually need to be looking seriously at how we actually provide for an aging population. A lot of countries, Northern Ireland included, have their own older people strategies or such by different names, which does look to bring together different government departments to achieve the objectives within it. But I don't think we can sort of look at health independently without actually looking at the environment that the person lives in. So if we want to take an older person and allow them to live at home, are we investing in the person's home with the technologies and with everything else that's actually needed to allow them to live independently? At the minute, there are any number of sensors out there that can actually tell whether the person gets out of bed, whether they're in bed, how long they're in the bathroom for, whether the kettle, they'll actually put the kettle off at a certain period of time. We actually need to be doing more with that. We need to be making those investments. But importantly as well, we should also be looking to the house building industry to actually say to them, you know, let's start future-proofing housing here. Let's actually start putting in place into the structure, whether it's plugs, whether it's whatever else that's needed for the person as they grow older, their house can be simply adopted. At the minute, if we were to actually adopt houses, we're into a much higher cost. So again, it's actually what you're actually saying, Fearghal, it's sitting here looking at the problem, but we can't sit here in 5 years' time and talk about the same problem unless we're actually saying, you know, there is a responsibility on government here to actually take that 5-10 year view. It needs not to just look at the health of the population, it actually needs to look at the environment that the person lives in, whether it is in their own home, it's how they commute around their town, it's the facilities that we actually provide for them. Do we make it easy for them to get to a library? There's a question. If a person possibly early onset dementia or maybe some other brain injury, and you know, should we restrict them to their homes, or should they be able to go out and to go for a walk in the street, knowing or allowing a family member to know that their path will be actually monitored through sensors in a town that actually picks up a GPS coordinate and actually says, well, John has left the house. 2 minutes later, John has arrived at going past a certain shop. But equally, 5 minutes later, John hasn't got to the next point in the journey. Somebody is able to say something has happened, John, between point B and C. So I think we need to look at how we design our towns, how we design our cities, how we design our homes, and the types of things that we put in there. Some countries and regions are actually doing a lot of good work on that. I think at Greater Manchester are doing work and actually sort of looking at enabling people to move around the city through sensors. There's companies in the Republic of Ireland that are actually developing apps that will actually allow people with dementia to be able to go and to navigate their own way around the town, but sending information back the whole time on the person so that their safety is maintained as well. So we really need to know an awful lot more. What is the art of the possible, and where is our vision, and how do we actually make the two marry up together?
John, thank you very much indeed. It just strikes me, just as a final comment, that, you know, if you make the biggest vision, then you'll make more progress on the earlier foothills. That's at least a potential, rather than just seeing it as a limited problem and then staying in the foothills. So
totally, and that maybe sort of reflects when I left the public sector and decided to go out by myself. I had a vision that I actually created for myself, and I knew I wouldn't achieve it in 6 months or in 1 year. You know, I have a vision that I'm working to where I know I want to be in 5 years. Everything I'm doing at this point in time is my steps to get to that place. And I think for me, as a very small right setup, if that discipline and that principle works for me, and I will have failures on the way, but you know what? I need to embrace those failures. I need to learn from them. I need to move away from a culture that actually criticizes anybody that fails, rather than actually encouraging and supporting them to understand how they failed and to move ahead and to make progress. And I think there is something in that. Move away from the culture of blame and try to move towards a culture of innovation and supporting people to get there.
John Farrell, thank you very much indeed for your time, your contribution, and your vision.
Thank you very much, Fearghal.